In reality, EHR systems and standards vary dramatically. FIHR is a modern, flexible standard, but adoption is inconsistent. Each clinic or hospital may run different EHR systems, versions, or configurations. Cloud-hosted solutions face data residency, privacy, and infrastructure requirements, especially in countries like Germany or France, and many still rely on legacy systems without modern interfaces. I am Yuri, and we are here to discuss some of the most common EHR integration myths that one is likely to face.
EHR integration is standardized across Europe.
In reality, EHR systems and standards vary dramatically, and between countries often, and sometimes between regions and hospitals, even within the same country. While FIHR is gaining ground, legacy standards like HL7 or XDT and some other old interfaces still widespread. So there is no single EHR standard. Be ready for fragmentation and plan for country-specific integration. In practice, all standards are different. That's why we need to come from the existing reality.
FIHR makes integration fast and easy.
It's a myth. FIHR is a modern, flexible standard, but adoption is inconsistent, and many so-called FIHR implementations are partial, outdated, or even non-compliant. Developers often still need to build some custom adapters or fill gaps manually. FIHR is a great foundation, but not a plug-and-play solution. Always validate how the target EHR implements FIHR.
Integrating with one clinic means it will work with other clinics.
In reality, each clinic or hospital may run different EHR systems, versions, or configurations, even within the same ecosystem vendor. Integration often involves manual mapping, configurations, and testing for each new client. Treat every new clinic as a fresh integration. Reusable components of course help, but don't count on one-size-fits-all.
FIHR is mandatory for all healthcare institutions.
While FIHR is widely promoted standard, its adoption is not yet universal or legally required in all regions. Many healthcare institutions still use older formats like HL7, XDT, and other old interfaces. Never assume FIHR compatibility. Verify the actual data exchange standard in use before planning integration.
Cloud EHR is better than on-premise.
It's a myth. Cloud-hosted solutions face data residency, privacy, and infrastructure requirements, especially in countries like Germany or France, where healthcare data must stay inside the country or pass some strict hosting certifications. Cloud-based EHR need local compliance strategies to succeed.
Every clinic must have KIS-API.
In reality, not all clinics are required to provide KIS-API, and many still rely on legacy systems without modern interfaces. Integration often requires custom connectors, middlewares, or alternative data exchange methods. Don't assume API access. Verify integration options early and plan for flexibility in connecting with different clinical systems.